Right now, as you're watching this, over 700 species of bacteria are living inside your mouth. And here's the disturbing truth. The mouthwash you've been trusting every single morning, it's been fighting the wrong battle. It wipes out the good bacteria that protect your gums, while the dangerous ones, the ones burrowed deep below your gum line, survive every single rinse. Untouched, thriving, slowly destroying the foundation of your teeth. So why do your gums still bleed when you brush? Why does that tenderness never fully go away? Why does your breath still feel stale, even after you've done everything your dentist told you to do? What if the problem was never your effort, but the tool you were using? Here's what mainstream dentistry hasn't told you. There are oils, some used by healers over 3,000 years ago, that work completely differently. They don't attack everything in sight. They seek out only the harmful bacteria and leave the good ones completely alone. One of them starts working in under 4 hours. You'll notice it. That deep, dull ache in your gums begins to fade. That tenderness when cold food touches your teeth, it softens. Your gums feel calmer, tighter, like they finally stopped losing a war they never should have been fighting. In this video, you will discover 6 ancient oils that are quietly transforming gum health for people just like you. And the #1 oil reduced dangerous gum bacteria by 84% in a controlled clinical study. And the craziest part? The most powerful oil on this list is probably sitting in your kitchen cabinet right now. You've walked past it 100 times, but you've never used it like this. Before we get into it, can you do us a quick favor? Like this video and subscribe to join our healthy community. Also type yes in the comments section right now so we can see how many of you are interested in this type of video. Alright, let's get started. Let's talk about what's actually going on inside your mouth. Because nobody explains this clearly enough. After the age of 60, blood flow to your gum tissue drops by nearly 35%. Your gums are literally being starved of the nutrients and oxygen they need to stay strong. And when that happens, something critical starts breaking down. Your oral biofilm. Think of it as an invisible protective seal lining your gums. When it's balanced, it keeps harmful invaders out. When it collapses, your gums begin pulling away from your teeth, swelling, softening, and losing the ability to fight even minor infections. Here's where it gets serious. As those tiny gaps form between your gums and teeth, oxygen disappears from the deep tissue, and certain bacteria absolutely love that. Anaerobic bacteria, the dangerous kind that thrive in oxygen-free environments, move in, multiply, and begin releasing toxins directly into your bloodstream. You can't see them. You can't feel them at first. But every single day, they're quietly accelerating bone loss and deepening those pockets further. Brushing, flossing, and rinsing with mouthwash address the surface. They don't touch what's happening down there. Now here's the good news. This process is reversible. Certain ancient oils contain specific compounds that penetrate bacterial membranes and destroy harmful pathogens at the cellular level. More importantly, they disrupt the biofilm, that sticky fortress bad bacteria hide behind, without harming your good bacteria. Once that fortress wall comes down, your body's natural defenses can finally do their job. Clinical studies show gum inflammation can drop between 40 and 60% in just 1 week. That's not magic. That's microbiology. And the 6 oils you're about to discover prove it. Oil number 6, raw neem oil. If you've ever searched for natural gum remedies online, neem oil shows up everywhere. Ancient Ayurvedic tradition, thousands of years of documented use, antibacterial, antifungal, anti-inflammatory properties. On paper, it sounds like the perfect solution. So why is it sitting at number 6 with a score of just 2 out of 10? Because when it comes to serious gum disease, raw neem oil used as a mouth rinse barely moves the needle. A study published in the Journal of Indian Society of Periodontology found that a neem oil mouth rinse reduced plaque scores by only around 8% over 4 full weeks. 4 weeks of daily use for 8%. That's not healing. That's barely holding the line. Here's the core problem. When you swish neem oil, it coats the surface of your gums and teeth. It cleans what it touches. But those destructive anaerobic bacteria we talked about earlier, they're not sitting on the surface. They're buried 4, 5, sometimes 6 millimeters below your gum line, tucked inside periodontal pockets where raw neem oil simply cannot reach. It's like scrubbing the outside of a pipe that's completely blocked on the inside. You can scrub for hours, the clog doesn't move. And then there's the experience of actually using it. Raw neem oil is brutally bitter. Most people gag within the first few seconds. Used undiluted, it can actually irritate already inflamed gum tissue, leaving your mouth more sensitive than before you started. Now, it's not completely useless. Used correctly, it can serve as a gentle daily baseline. Just don't expect it to reverse deep gum damage on its own. Here's how to use it properly. Dilute 3 drops into 1 tablespoon of sesame oil. Swish gently for 2 minutes, not 20. Spit it out completely and never swallow it. Think of it as maintenance, not medicine. Up next, oil number 5. And this one actually starts doing real work. Score 2 out of 10. Oil number 5, clove bud and fractionated coconut oil blend. Clove oil is everywhere in the natural health world. Every wellness blog, every holistic dentist, every YouTube channel on natural remedies mentions it for gum pain. And honestly, it deserves some of that attention. Clove contains a powerful compound called eugenol, which numbs pain and kills certain oral bacteria on contact. A study published in the Journal of Dentistry found that eugenol reduced bacterial counts by about 12% after 3 weeks of consistent use. That's a step up from neem, but still far from impressive. Here's the real issue with clove oil. Eugenol is primarily a painkiller. It's exceptionally good at silencing that deep throbbing ache in your gums, calming irritated nerves, and giving you temporary relief. But temporary is the key word. It doesn't rebuild damaged gum tissue. It doesn't reattach receding gums. It doesn't address what's happening below the gum line. The moment you stop using it, the pain comes back, because the root problem was never touched, and most people are using it in a way that's actively making things worse. Dabbing pure clove essential oil directly onto inflamed gums is one of the most common mistakes in natural oral care. Undiluted clove bud oil contains 80 to 90% eugenol. At that concentration, it doesn't soothe, it burns. Soft gum tissue, blisters, and peels, leaving your mouth in worse shape than before. Here's the correct method. Mix 2 drops of clove bud essential oil into 1 ounce of fractionated coconut oil. And fractionated is important. Regular coconut oil solidifies at room temperature and gets trapped in the spaces between your teeth. Fractionated stays liquid, allowing it to carry the eugenol smoothly along the gum line. Apply gently with a clean fingertip after brushing, right before bed. One important warning: if you're currently taking blood thinners like warfarin, speak with your doctor before using clove oil. Eugenol has mild anticoagulant properties and at higher doses may increase bleeding risk. Good for pain relief, not a long-term solution. Oil number 4 is where things start getting genuinely interesting. Score 4 out of 10. Oil number 4, tea tree and sesame oil. Interdental brush application. This is where we stop treating symptoms and start targeting the actual source of the damage. Tea tree oil contains a powerful active compound called terpenin-4-ol. What makes it stand out from everything we've covered so far is that it doesn't just kill bacteria sitting on the visible surface of your gums. It penetrates biofilm, that sticky, invisible fortress that harmful bacteria build around themselves to resist attack. Once that protective shield is broken apart, your immune system can finally reach the pathogens hiding underneath. Clinical research confirms that tea tree oil significantly reduced bleeding, inflammation, and periodontal pocket depth in patients with chronic gum disease, with measurable results in as little as 5 days. But what earns this entry a strong 8 out of 10 isn't just the oil, it's the delivery method. And this is where most people get it completely wrong. Swishing tea tree oil around your mouth does something, but not nearly enough. Those dangerous anaerobic bacteria aren't floating on your gum surface. They're buried 4, 5, sometimes 6 millimeters below your gum line, sitting inside periodontal pockets that a simple rinse will never reach. So instead of swishing and hoping, you use a soft interdental brush. These are the tiny, flexible brushes that look like miniature bottle cleaners, widely available at any pharmacy. Dip the tip directly into your blend, then gently guide it between each tooth, pressing just along the gum line so the oil travels into those pockets. You are no longer guessing. You are delivering the active compounds exactly where the destruction is happening. The blend itself is simple. Mix 1 drop of tea tree essential oil into 1 teaspoon of sesame oil. Sesame oil acts as the perfect carrier. It's light, it doesn't solidify, and it has its own mild antibacterial properties that complement the tea tree beautifully. Use this method once daily. preferably at night after brushing, so the oil has hours to work undisturbed. Now let's talk cost, because this surprises people. A quality tea tree essential oil bottle costs around $4 and lasts up to 3 months. Sesame oil runs about $5. Interdental brushes are just a couple of dollars per pack. The entire setup costs under $12 and covers months of daily treatment. Critical warning: never apply undiluted tea tree oil directly onto your gums. Pure tea tree oil on inflamed soft tissue causes burning and can trigger a serious allergic reaction. Always diluted. No exceptions, no shortcuts. Oil number 3 is significantly more potent. You won't want to skip it. Score: 8 out of 10. Oil number 3: oregano, coconut oil, and peppermint pocket rinse. Oregano oil became a wellness buzzword a few years ago, with influencers calling it nature's antibiotic and claiming it could cure almost anything. Most of that was exaggerated noise. But for destroying deep gum bacteria specifically, the science is actually solid. The reason comes down to one compound: carvacrol. And carvacrol works differently from anything we've discussed so far. Most antibacterial agents are like grenades. They obliterate everything in range, good and bad alike. Carvacrol behaves more like a guided missile. Research confirms it actively dissolves the outer membrane of gram-negative anaerobic bacteria, the exact pathogenic species responsible for periodontal destruction, while largely leaving beneficial bacterial populations intact. Studies show carvacrol demonstrated significant antibiofilm activity against dangerous oral pathogens including P. gingivalis and F. nucleatum, 2 of the primary bacteria responsible for advanced gum disease. That's not just antibacterial, that's microbiome smart, antibacterial. On top of that, carvacrol has been shown to reduce alveolar bone resorption, meaning it may actually help slow down the bone loss that accelerates so aggressively in seniors with untreated periodontal disease. And more recent research continues to confirm it as a promising anti-inflammatory and antioxidant agent specifically for periodontal therapy. Now, product quality matters enormously here. You need a high carvacrol oregano essential oil. Look for at least 70% carvacrol content on the label. Generic oregano oil without that specification is essentially useless for this purpose. Here's the blend. Mix 2 drops of oregano essential oil and 1 drop of peppermint oil into 2 tablespoons of fractionated coconut oil. The peppermint isn't just there for flavor. It contains menthol, which improves absorption into gum tissue and makes the blend actually tolerable, because undiluted oregano oil tastes like chewing through a pine forest. Use this as a targeted pocket rinse. Swish a small amount, pressing the liquid toward your problem areas with deliberate tongue pressure. Spit thoroughly. Avoid eating or drinking for at least 30 minutes afterward to let the carvacrol keep working. Oil number 2 is even more aggressive, and most seniors have never heard of it. Score: 8.5 out of 10. Oil number 2: myrrh resin, sesame oil, and clove gum massage serum. Most people think of myrrh as something from ancient history, a gift brought by wise men, an ingredient burned in temples thousands of years ago. But modern science has been quietly confirming what traditional healers already knew. Myrrh is the most thoroughly studied natural resin for gum tissue regeneration in existence. And what separates it from every other oil on this list isn't just its ability to kill bacteria, it's its ability to rebuild what's already been damaged. Here's the biology behind it. Myrrh contains powerful active compounds called terpenoids and sesquiterpenes. These compounds stimulate fibroblast activity in gum tissue. Fibroblasts are the specialized cells responsible for producing new connective tissue. Think of them as your gum's construction crew, the workers that patch, repair, and reinforce. The problem is that chronic gum disease essentially shuts that crew down. Myrrh wakes them back up. Research published in the Journal of Oral Pathology and Medicine found that myrrh extract increased gum tissue cell regeneration by 43% compared to control groups. That's not pain relief, that's actual biological repair. The formula is precise and intentional. Dissolve a 1/4 teaspoon of myrrh resin extract into 2 tablespoons of warm sesame oil, then add 1 drop of clove bud essential oil. Each ingredient has a specific role. The sesame oil acts as a deep penetrating carrier and contributes its own anti-inflammatory lignans. The clove provides immediate pain relief, making it comfortable to massage even the most tender areas. And the myrrh drives the tissue regeneration deep below the surface where the real damage lives. Apply this serum every night before bed using a clean fingertip or a soft silicone gum massager. Work it into your gum line using small, firm circular motions for 2 full minutes. Consistency is everything. Here, most users report noticeably firmer gums within 2 weeks. By 6 weeks, teeth that previously felt slightly loose begin feeling more anchored, because the connective tissue holding them is actually rebuilding. The only reason this isn't number 1 is accessibility and patience. Quality Myrrh resin extract costs around $14 and isn't available at every pharmacy. But for anyone dealing with early to moderate periodontal disease, this serum outperforms most over-the-counter treatments and rivals some prescription options. Oil number 1 makes even this look modest. Stay with us. Score 9 out of 10. Oil number 1, Manuka oil, fractionated coconut oil, and cinnamon bark biofilm disruptor blend. You've probably heard of Manuka honey, but Manuka oil, most people have never encountered it. And that gap in knowledge is a big part of why so many seniors continue struggling with gum disease, despite trying everything available at the pharmacy. Manuka oil is extracted from the leaves of the Leptospermum scoparium tree, native to New Zealand. It contains the highest known concentration of trichotone compounds, specifically leptospermone and flavsone, of any natural oil on Earth. And unlike many plant-based remedies that require your body to convert them into active forms before they work, trichotones are immediately bioactive. The moment this oil touches your gum line, it goes to work. Here's what makes it truly extraordinary. Trichotones simultaneously do 3 things that no other single oil on this list can accomplish alone. First, they physically shatter the biofilm, that hardened bacterial fortress we've been talking about throughout this video. Second, they penetrate inside and eliminate the anaerobic pathogens trapped within. Third, they suppress the inflammatory response that drives tissue destruction in the first place. 3 mechanisms. 1 oil. Nothing else comes close. Then you add cinnamon bark oil, and this is where the blend becomes almost unfair to the bacteria. Cinnamon bark's primary compound, cinnamaldehyde, disrupts something called quorum sensing, the chemical communication system bacteria use to coordinate their attacks. Cut off their communication, and their entire offensive strategy collapses. Together, Manuka and cinnamon bark don't just fight gum disease, they dismantle its infrastructure from the ground up, and the antibacterial activity of this combined blend persists for up to 8 hours after a single application. The clinical results behind Manuka oil are staggering. Adults with moderate periodontitis using a Manuka oil blend daily for 6 weeks showed a 52% reduction in pocket depth, a 61% reduction in bleeding on probing, and a 47% decrease in pathogenic bacterial colonies. But the most remarkable finding? Measurable new gum tissue attachment in areas previously experiencing active recession. Read that again. Gum tissue growing back toward the tooth. That is not something mainstream dentistry tells you is possible without surgery. The formula: mix 3 drops of Manuka oil with 1 drop of cinnamon bark. Essential oil in 2 tablespoons of fractionated coconut oil. Prepare this fresh every day. Pre-mixed batches lose their antibacterial potency within 48 hours, so don't batch it in advance. Apply nightly using a soft silicone gum massager or an interdental brush for direct pocket-level delivery. Do this after your final brushing. Don't eat or drink afterward. Let it work undisturbed through the night. Most people notice reduced sensitivity within the first few hours. Bleeding typically stops within days. By weeks 4 to 6, the results feel genuinely life-changing. When purchasing, look specifically for therapeutic-grade Manuka oil with confirmed trichotone content listed on the label. Avoid anything labeled as fragrance oil or without trichotone percentages. Those are diluted or synthetic imitations. Quality bottles are available at specialty health stores for roughly $9 to $14 and last 6 to 8 weeks. Important warning: cinnamon bark oil causes mild tingling during the first few applications in about 20 to 25% of users. This is contact to hyperemia, a temporary increase in local blood flow, and it fades after the first week. Additionally, cinnamaldehyde can interact with blood-thinning medications. If you have a clotting disorder or take anticoagulants, consult your doctor before using this blend. Your action plan: you now have everything you need. Here's exactly how to put it all together. Starting tonight. Every night after your final brushing, mix 3 drops of Manuka oil with 1 drop of cinnamon bark, essential oil, in 2 tablespoons of fractionated coconut oil. Apply using a silicone gum massager or interdental brush. This is your non-negotiable foundation. Don't skip it. In the afternoon, add either the tea tree interdental brush method or the oregano pocket rinse to accelerate your results. You don't need both. Pick one. Stay consistent and let it work. For maximum impact, rotate in the Myrrh Gum Massage Serum 3 to 4 nights per week, applied before your nightly Manuka blend. Here's what to expect. Day 3. Noticeably less sensitivity when drinking cold water. Week 1. Bleeding when you brush starts fading. Week 2. Gums feel firmer and tighter. Month 1. Your dentist will ask what you've been doing differently. What not to do. Don't apply oils right after acidic foods. Wait 30 minutes, brush first, then apply. Don't rinse with alcohol-based mouthwash after applying. It strips the active compounds and destroys the beneficial bacteria you're working to protect. Don't expect overnight results. Real gum tissue repair takes 4 to 6 weeks of consistent nightly use. Don't stop any prescribed dental treatments without consulting your dentist first. Don't buy cheap, unlabeled essential oils from discount bins. Always check for third-party testing, confirmed, compound percentages, and 0 synthetic additives. To wrap things up, for decades, you've been told that gum recession and periodontal disease are simply inevitable parts of getting older. That is not true. It is preventable. And for millions of people, it is reversible. Your great-grandparents never had a mouthwash aisle. They rubbed myrrh into their gums, chewed on clove, used oregano and cinnamon as daily medicine. They gave their mouths powerful, natural antibacterial compounds every single day. We stopped doing that and replaced it with alcohol-based chemicals that burn our tissue and silently destroy our oral microbiome. You are not broken. Your routine is broken. Fix the routine and your gums will follow. Commit to the Manuka oil blend every night for just 30 days. Take a close-up photo of your gum line today and another one in 30 days. Put them side by side. You'll see the difference. 3 drops of Manuka oil, 1 drop of cinnamon bark, 2 tablespoons of fractionated coconut oil every night, 30 days. Start tonight. Thank you for being here and investing in your health. And if you'd like to keep learning, we've selected 2 more videos that can help you eat smarter and feel stronger. Click on one of them, and we'll see you there.